Physical therapy has always been the profession of movement, but the next era is about clarity, first contact care, faster triage, and the right diagnostic tool at the right time. Today, I'm walking you through the hands-on diagnostics new position statement, why it matters now, what it changes clinically, and how it can reshape the business model for outpatient physical therapy. Well, let me hit you with a reality check. Outpatient physical therapy is under pressure. Access issues, delayed diagnosis, inefficient episodes of care, and payment that often does not match your responsibility. Here's the question. What if physical therapy becomes the front door for neuromusculoskeletal care supported by competency-based diagnostics and modern pathways so patients get answers sooner and practices become sustainable again? That's exactly what the hands-on diagnostics position statement is about. And this is approved by our board of directors, and it lays out a clear vision for the profession's next necessary evolution. So this is going to be very interesting. So stay with me. Welcome back to Your Practice, Your Money, the show where clinical success meets financial freedom. I'm your host, Dr. Dimitrios Kostopoulos, and if this show helps you to think bigger, to practice smarter, or earn more sustainability, please subscribe on Apple Podcasts, Spotify, or wherever you listen. And if you can, please leave a quick review as it helps more owners find the show. And you can always go to the website yourpracticeyourmoney.com for additional resources. And if you are a practice owner or a clinician who wants to lead the future instead of reacting to it, then this episode is for you. The hands-on diagnostics new position statement that was just recently released. The position statement is approved by the hands-on diagnostics board of directors, and I'm going to break down this position statement today in 5 practical segments. First, primary care physical therapy, what first contact really means. Number 2, diagnostics as a competency-based expansion and why this is about decision making and not just more tests. Number 3, 2 complementary missions, training and implementation. Number 4, very important, equitable payment and system savings. And why does this matter economically? And number 5, we'll talk about this new paradigm shift and what's already measurable and why you should act now, reaching the future of physical therapy, which is here right now. Everything I'm sharing here is drawn directly from the HODS position statement, which can be viewed and read in its completeness at yourpracticeyourmoney.com, as well as on the website of Hands-On Diagnostics at handsondiagnostics.com. Here is the core belief. The physical therapy profession is ready for its next and necessary evolution. Physical therapy as first contact. Primary care providers for neuromusculoskeletal conditions, supported by competency-based diagnostic testing and modern care pathways. Well, let's define now primary care physical therapy the way we mean it in our statement. It's about rapid triage, it's about evidence guided conservative care, it's about early identification of risk and timely escalation when medical or surgical evaluation is indicated. This is not physical therapy replacing physicians. This is physical therapists stepping into what we already do at our best, high-level clinical reasoning, and strengthening it with standardized pathways and objective tools when needed. And the statement is very clear about the standard. Primary care is not just a role. Primary care physical therapy is not just a role. It is a responsibility. The responsibility requires preparation, and so hands-on diagnostics has filled that preparation by filing already with ABPT-RFE a candidate residency program in primary care physical therapy to train you, the clinicians, for modern first contact practice. More to follow in future episodes. And this is not a vibe, it is an infrastructure move that hands-on diagnostics has made for the benefit of the entire physical therapy profession. This part makes some people feel uncomfortable because they confuse it with scope creep or ego or doing more tests. Well, the position statement shuts that down immediately. Well, diagnostics like EMG, nerve conduction studies, and musculoskeletal ultrasound are not about doing more tests, are not about replacing the clinical examination tests that already physical therapists do. They are about making better decisions, faster, with the right tool at the right time. And let's split this into two key domains. First, electromyography, nerve conduction studies, which offer precision in neuromuscular decision making. The position statement emphasizes that physical therapy engagement in electrodiagnostics must be paired with rigorous training, mentorship, quality assurance, and ethical diagnostic stewardship. And it explicitly states that the EMG nerve conduction studies residency training pathway, which is offered through both hands-on diagnostics and the American Academy of Clinical Electrodiagnosis, simply serve this goal, serve this purpose. Well, the second component is musculoskeletal ultrasound imaging that offers real-time clarity for musculoskeletal care. The statement places strong emphasis on musculoskeletal ultrasound imaging as a defining capability for the future of musculoskeletal care. It highlights that the American Academy of MSK Ultrasound, AAMU, provides structured training through a fellowship, a diplomate, and certificate pathways, and that the fellowship program is approved by AIUM as a point-of-care ultrasound approved program. And then comes the line, I want every practice owner to tattoo onto their strategy. MSK ultrasound is not a nice to have. It is becoming a core tool in modern musculoskeletal primary physical therapy care. In the recent combined sections meeting, there were so many presentations that highlighted exactly this point, that musculoskeletal ultrasound imaging has become a core tool in modern physical therapy as a primary care profession. Clinically, what is the point? You have better triaging of patients, faster clarity of what the patient's problem is, smarter plans of care because you know faster and with greater clarity and precision what the patient's problem is, and also improved patient education through immediate visual feedback. The patient simply can see inside their body. You can see inside the patient's body, and not only a static image, but a dynamic image while the patient moves an extremity or you move a joint. Business-wise, diagnostics are not a gimmick. They are a sustainability lever when done responsibly. This is where HODS now is different from random weekend courses. And I'm going to talk about training and implementation. The HODS position statement specifically describes that we have two complementary tracks. The first track is the HODS, the hands-on diagnostics track, that supports physical therapy private practice owners with both clinical and business implementation, and teaches them how to build diagnostic testing services alongside their physical therapy services. And then we have the other pathway. The pathway is offered by the American Academy of Clinical Electrodiagnostics and the American Academy of Musculoskeletal Ultrasound, which provide advanced clinical training to physical therapists and other qualified healthcare professionals, regardless of setting, whether it is private practice, hospital-based, or academic. And the key principle, the profession advances fastest when training is broadly accessible and implementation is operationally supported. And this is why hands-on diagnostics is making now available our training programs throughout the United States at close proximity to where you are located so that you do not have to spend a lot of money on traveling expenses. In plain language, it is not enough to learn the skill. You need systems, you need quality assurance, you need workflow, reporting, compliance, operational design. So diagnostics elevate care instead of creating a chaos. How about reimbursements? Equitable payment. This segment matters because it's the bridge between clinical value and the financial reality. The HODS statement says outpatient physical therapy must achieve more equitable payment aligned with expanded responsibility in primary care and diagnostic-enabled decision-making. It also makes a direct healthcare economics claim. Earlier detection and faster clarity reduces delayed diagnosis, prolonged inefficient care episodes, unnecessary referrals and expensive imaging, and avoidable disability or chronicity. Then it lands this. Diagnostics in physical therapy is a value strategy, not only for the physical therapy profession, but for the healthcare system. I'll repeat that. Diagnostics in physical therapy is a value strategy, not only for the physical therapy profession, but for the healthcare system. So if you're a practice owner thinking, is this worth it? Well, think bigger. This is about what you are worth by delivering measurable clarity and outcomes that the system claims it wants. How about a proven paradigm shift in the physical therapy profession that we have witnessed for the past 5 to 10 years? Now, the statement doesn't present this as a theory. It presents it as measurable momentum. Hands-on diagnostics affiliated practices span 30 plus states in our country. Diagnostic testing integrated into physical therapy practice contributed to 61% better patient management, with changes in clinical decision management for the patient. And the published hands-on diagnostic study reported that more than 92% of their patients were very satisfied and satisfied with the diagnostic-enabled care experience because it helped them to participate more in their care and have better results. And diagnostic testing service lines may generate 3 to 10 times higher reimbursements per diagnostic encounter compared with standard physical therapy visits. And then one of my favorite lines in the whole document. Hands-on diagnostics members are not following the trend. They are building it. That's not bravado. That's a call to leadership. If you're listening and thinking, how do I apply this? Here are 3 action paths, I would say. 1, if you are a clinician, commit to primary care level reasoning. Upgrade your triage, your pathways, your risk identification. Number 2, clinicians who want advanced capability, pursue competency-based training with mentorship and quality assurance baked in. Don't shortcut the standard. And practice owners, think in systems, think bigger. Diagnostic services require operational design, quality assurance, reporting standards, and clean workflows. So the service line strengthens the practice instead of distracting from it. Physical therapy has always been a profession of movement. Now, it must also be a profession of clarity, leadership, and clinical authority. Hands-on diagnostics stands for PTs as first contact clinicians. Diagnostics used responsibly and skillfully. Practices that thrive financially because they deliver higher value care. A healthcare system that saves money because patients get the right answers sooner. This is the new paradigm. And it's being built practice by practice, patient by patient, across the country right now. And it is your opportunity to join this movement. Well, my friends, if you got value from this episode, please subscribe to Spotify, Apple Podcast, and wherever you listen. And if you know of a practice owner who's feeling squeezed right now, send them this episode. This is how we raise the standard and protect the future. If you like to have a quick meeting with me and discuss about strategy and implementation for your practice, go into the link right now, schedule a meeting so I can potentially meet with you in the next few weeks. See you next week. Until then, keep building clinical success and financial freedom. Take care.